Eclipse Spinal Orthosis fitting instructions. Adjusting and sizing the brace. Determine the appropriate belt length by measuring the patient's waist and hip circumference. Use the larger of the two circumferences when selecting brace size. To set the brace length, open the brace and lay it flat. Remove the lateral panels if it is the APL model with lateral panels prior to setting the length. Reposition the pull tabs to the back panel material to keep them out of the way during sizing. Peel up the Velcro on the left and right belt wraps and slide until the desired length is achieved. Fold the belt wrap end over and press to secure hook and loop material. Repeat for the opposite side. Both the right and left must be adjusted equally for proper brace performance. If it is an APL model, replace the lateral panels with the narrow end pointing toward the middle of the back. Applying the brace. For a proper fit, prepare the brace by ensuring the brace is extended prior to each application. Place the pull tabs close to the back panel and create slack in the pulley system by pulling the ends of the belt wraps away from each other. To position the brace, center the back panel on the lower back. Slide your fingers through the loops on the belt wrap ends to assist with application. To apply the brace, wrap the belt around the abdomen and overlap the right and left ends. Right over left. Press firmly to engage the hook and loop closure. When applied correctly, the brace should fit snug at the top and bottom. If there is a gap, reapply and angle the belt wraps slightly to ensure a snug fit at upper-lower edges. Pull the finger pull tabs out and away from the body until the desired tension and support is achieved. Finally, secure the pull tabs onto the front of the brace. Note: for comfort while seated, lessen the tension on the upper portion of the back panel, the left pull tab. Reapply tension upon rising. For the APL model only, the lateral panels should be placed on the midline of the belt, above the iliac crests. Indications: indicated for acute and chronic low back pain, disc herniation, stable non-displaced fractures, and post-op stabilization. Contraindications: contraindicated for unstable, displaced fractures, women who are pregnant, persons with circulatory, pulmonary, cardiovascular, or other conditions where increased abdominal pressure could worsen risks. Warnings: if you experience pain, swelling, sensation changes, or unusual reactions while using this product, contact VQ OrthoCare's Patient Care Department at 800-452-7993 or contact the provider that delivered your brace or consult your physician. For single patient use only. Eclipse Spinal Orthosis fitting instructions. For more information, contact VQ OrthoCare at 800-266-6969 or for international, call 949-261-3000. Visit our website at vqorthocare.com